Hi viewer, welcome to back my YouTube channel. Here's the new video: Medicine and Healthcare in the United States. The healthcare debate in 2009 and 2010 illustrated the practice of medicine in the United States raised many important issues about its cost and quality. Before we discuss some of these issues, a brief discussion of the history of medicine will sketch how we have reached our present situation. Loudon 1997, Porter 216, Loudon 1997, Western Edition and Illustrated History of Oxford, England, Oxford University Press, Porter, RD 216, The Cambridge History of Medicine, New York, Cambridge University Press. The rise of scientific medicine, the practice of medicine today in the United States and much of the rest of the globe follows the scientific approach. But scientific medicine is a relatively recent development in the history of the world. Prehistoric society attributed illness to angry goods or evil to spirits that look over someone's body. The development of scientific medicine since then illustrated one of the sociological insights discussed at the beginning of this chapter, the type of society influenced belief about healthy and ways of healing. The root of today's scientific medicine goes back to the ancient civilization in the Middle East, Asia, and Greece and Rome, which began to view health and illness somewhat more scientifically. In ancient Egypt, for example, physicians developed some medicine such as laxatives that are still used, and they also made advances in the treating of wounds and other injuries. The ancient Chinese developed several drugs including arsenic, sulfur, and opium that are also still used. Ancient India developed anesthetic antidote for poisonous snakebite and several surgical techniques including amputation and the training of Ipsons, Porter 260, Porter RD 260, the Cambridge History of Medicine Review in New York, and Cambridge University Press. Ancient Greek built a medical school in which the addition of animal was used to help understand human anatomy. Later, a Greek physician named Galen, who lived in Rome during the 1000 AD, wrote influential treatises on inflammation, infection, disease, and the muscular and spinal cord system. Medical advance continued in the Middle Ages and the Renaissance. Various physicians wrote about smallpox, measles, and other diseases, and several medical schools and hospitals were established. Leonardo da Vinci and other scientific performed many dissertations and produced hundreds of drawings of human anatomy. Other major advances, including the development of surgical technique and the treatment of burns, were also made during this period. What is now called modern medicine began in the 16,000 days. Scientists learned how blood circulates through the body and used microscopes to discover various germs, including bacteria. By the end of the 1800s, the germ theory of disease had become widely accepted thanks largely to the work of Louis Pasteur and other scientists. Other key developments during this time include the discovery of the either gas as an effective anesthetic and the realization that surgery need to be carried out under the strict standard of cleanliness for air. Porter, the RD Cambridge History of Medicine, New York, and Cambridge University Press during the 18,000. The American Medical Association and other professional associate physicians were found to advance medical knowledge and standard and help to give physicians a monopoly over the practice of medicine. Star 1982 Star 1982, The Social Transformation of American Medicine, New York. Basic book. In the early 19th, scientists learned about the importance of vitamin and penicillin was developed as the first antibiotic. Development in immunity, physiology, and many other areas of medicine have advanced far beyond what we knew a new century ago and remain too numerous and complex to discuss here. Scientific medicine has saved countless lifespan used to average no more than the age of 40 or so as the we have seen, but in industrial nation now average well into the 70s. Still, as we have also seen, huge disparity remain across the world today in lifespan and the quantity of health. Disparity also exists in the quality of health care. across the world. In the United States, questions about the cost and effectiveness of healthcare have dominated the news. We now turn to some of these issues. U.S. healthcare and the industrial world. Medicine in the United States is a big business expenditure for healthcare, health research, and other health equipment services have risen sharply recent year, having increased tenfold since 1980 and now cost the nation more than 2.6 trillion annually. See figure 18.6 US healthcare expenditure 1980 to 110 in billion of dollars. The translation to the largest figure per capita in the industrial world. Despite this expenditure, the United States large behind many other industrial nations in several important health indicators as we have already seen. Please subscribe, like, share and press the bell icon on my YouTube channel. Thank you for watching my videos.